is Mogbonju Nigeria Limited Virtual Medical Exhibition 2020. We are glad you could join us online today for this show. This is the day 3 of our Medical Exhibition and Speaker Series 2020. And this happens to be the last day of this program. We are glad you could join us today. If you're just joining us, we are taking a virtual attendance. Kindly fill your details in the chat box below. That is your name, your email address, and also your contact phone number. We'll be glad to contact you after this program. And also we have on the chat box a link to our special promotional products catalog. Kindly click on the link, download the document, and also view the items we have for special discount. We are giving up to 10% discount on all of these products. And also we have extended that to all of the products that we support and distribute. So if you are going to get any of our products between now and end of October 2020, then you'll be sure to get a 10% discount. Thank you once again for joining us. This show is starting now. First on the segment today, on the show today, we're taking the company profile. And that is, let's hear a bit about the company, Mogbonju Nigeria Limited, who we are, what we do, and where we are located. So Mogbonju Nigeria Limited is an indigenous limited liability company based in Nigeria. We specialize in the manufacturing, distribution, we install, we maintain high quality medical equipment, medical furniture, surgical equipment, electrosurgical equipment, surgical instruments, and medical consumables. Mogbonju Nigeria Limited started as a medium-sized outfit under the trade name Mogbonju Enterprises in 1983. With this, it was a sole distributor and representative for the product of Seaward Medical Limited in the United Kingdom. Mogbonju Nigeria Limited distributes solely this product for over 2 decades and has since grown in reputation and scope. The company became incorporated on the 13th of November, 1980. That's about 36 years today. We have our offices located in Lagos and Abuja. Our office is located in Lagos and Abuja, and also we have our warehouse in Lagos. And of course, as a company, our vision is to be one of the best distributors of high quality medical equipment and also maintenance of high quality medical equipment and hospital products of first choice in Nigeria. We also have the mission to continually improve on the supply of healthcare products that conforms with international standards. We are talking in terms of quality and technology. As a company, we place high priority on quality. Price is just next, it's later. Number one for us is the quality of the product we are supplying. We don't compromise when it comes to quality. That is what we push out to our clients, our customers first. And of course, our core values are respect for human lives. We know that the product we sell and the journey are to be used to care for human beings. And so we don't just dump anything on our customers or just supply them any products, knowing that they will be used to save lives. So we go all out to give our best to supply high quality products that will not only meet the customer's needs, We also do more than the customer's expectations. So we place great priorities on human life. We have great respect for human life. And of course, we are professionals. The owner of the company, the management of this company, they are medical practitioners. So we understand and know what we actually supply. We know what we supply and what the extent of what we supply, the effect it can have if we don't supply quality. And so because of this knowledge, we always give quality products to our customers. And of course, we are passionate about what we do. It's something we have strong passion for, to ensure that in Nigeria, good quality products that will be used in the healthcare system are easily accessible and are readily available. Of course, we are very reliable, and our products are even more reliable. We place priority on quality, like I mentioned, and so you'll be sure to get the best out of every product that we supply. In this place, our word is, if we cannot guarantee it, then we cannot supply it. So we must be able to guarantee our products, we must be able to stand by them. When our customer calls for spare parts or repairs, we are very sure that we have capable hands, and also we can easily source the spare parts for them.
On the floor by that.
All products that we supply, we have spare parts support from the manufacturers, 100%. And of course, lastly, very resilient. Resilient in the sense that whatever thing you need in healthcare system, any product at all, no matter how hard it is to get, once you contact Mogbonju Nigeria Limited, that will be the end of your search. We go all out. We have manufacturers from various parts of the world in different locations and regions that will distribute their products. So if you have any product that has been so hard for you to get, I can assure you that once you call us, we'll be able to provide that and get a product for you. We don't give up. We don't believe in no. We go all out to give our best and then get to meet our customers' demands. And of course, like I mentioned, we have partners and we are distributor for various number of manufacturers in the whole world. Seaward Medical, we distributed for Seaward Medical for over 20 years. Seaward Tackling, and that's a manufacturing company in the United Kingdom. Also, we are distributor for Acosin range of products. We are their distributor in Nigeria. So if you need original Acosin, high quality, high grade Acosin, you'll be sure to get one from Mogbonju Nigeria Limited. Also, we distribute for Scalar Surgical Limited, a company that manufactures gynecological instruments, surgical instruments of high quality. This company, we have an standing with them, a contract agreement to apply maximum of 5 years warranty on surgical instruments for our customers. That is, we have the ability to give you up to 5 years guarantee on any of these products from this company. So our warranty for all our products ranges from 1 year to maximum of 5 years. We also distribute for Nidec. Nidec Medical is a company in the United States of America. They are the manufacturer of oxygen concentrators, high-grade oxygen concentrator. We are the distributor here in Nigeria. And of course, Ital Medical in the United States, we distribute your product as well. The maker in Germany. And also Sika. Sika products, we are their distributor in Nigeria, major distributor in Nigeria. During the course of this program, we are going to be taking some words from some of our manufacturers that we distribute for. Sika are the manufacturer of high quality medical weighing scales. So if you need a weighing scale that gives precision, high precision, when precision matters to you, then you think of Sika products, and we support all of their brands, all of the brands of products they have, from the least to the highest and even to the latest. Also, we distribute for 3B Scientific, a company in Germany that is a manufacturer of high quality training models for your medical schools, for trainings. We sell training models, and these are the distributors that we support. Their models are very, very good, very durable, very strong, close to a human with the kind of materials they use. Also, we are a distributor for Mediana Products, a company in South Korea. They're into they make patient monitors, make ECG monitors, and various types of monitors. Also, we are a distributor for Mindray. Mindray is a company in China. They produce high quality products. When you go across the globe, there is no country you won't see Mindray products, and Nigeria is not an exception. So we are one of the distributors here in Nigeria. So the list is endless. And of course, we've done for the past 35 years, going to 36 years now, we've done numerous projects, and we have successfully executed the projects. We've done a lot of projects with the federal government, hospitals, a lot with the state hospitals across Nigeria, and also private hospitals in Nigeria. We have a long-time relationship with hospitals, like the Ministry of Health, Lagos State Ministry of Health. We supply them, through them, we supply various hospitals in Lagos State. And of course, we supply to UCH Ibadan quite some products. And OAUTHC Ile-Ife, Federal Medical Centers across Nigeria, as well as National Hospitals in Abuja. Like I mentioned, we have some oil company that we also supply their hospitals and clinics, like Chevron Hospitals in Lekki, Bagada, in Shell Medical Centers in Lagos, Port Harcourt, Warri, and One, as well as NNPC Medical Services in Lagos, Abuja, Ogun State, Benin, and Warri. We also supply to private hospitals like McPherson University. We equip their nursing theater. And also, we supply to Nestle Nigeria. And not only Nestle Nigeria, we're able to supply also to Nestle Angola, Cote d'Ivoire, Cameroon, and Burkina Faso. We supply to Lagoon Hospitals, St. Nicholas Hospitals, Lafarge PLC, amongst others. Now, if you need any product from Mogbonju Nigeria Limited, our details are displayed right now on the screen. We have our headquarters office in Lagos at #1 Ajayi Road off Yaya Baton Road by Benyadun Street beside God's Chambers Church, Ifakoja, Lagos. And we have our Abuja office at House 22, 11 Road beside Procon Schools by Parfag Hospital, Federal Housing Estate, Lugbe in Abuja. Of course, our telephone numbers are displayed right now. Our email, you can contact us through our email, through any of the telephone numbers that are displayed right now on the screen. And to learn more about us and to see the project we've done in the past and the product we offer, you can visit our website on www.mogbonjung.com. We'll be sure to take your requests and also to attend to you promptly. Thank you for listening. If you have any question or any queries during the presentation, you can drop that in the chat box you want to make any inquiries, you can contact us on this program, or you can reach us through any of our numbers that are displayed. And you can as well write us an email through our email that is displayed on the screen right now. Remember, there's a 10% discount on all of our products, ranging from patient monitor and aesthetic machines and the likes, between now and the end of October 2020. So if you need anything, kindly contact us and we can apply this discount just for you. All right, so we continue the program. You're welcome once again. If you're just joining us, you're welcome specially to today's program. The next segment is the speaker segment. We're going to be having some interactive discussions with our speakers for today. Shortly, I'm going to be introducing them. But before I do that, if you're just joining us, kindly write your details. We are taking a virtual attendance. Kindly write your details in the chat box below. That is your name, your email address, and your phone number, so that I'll be able to contact you after this program. And in case you have any question or any inquiries during this program, message for us on the chat box, and then we will take your message. Also, the speakers will be coming on shortly. And after the speaker session, we're going to be having some presentations for you on some of our products for today. And then also we have a clips from our previous exhibition to show you, to see the numerous products that we support and we supply. Of course, we'll be introducing to you new products today that can meet your need. I will be taking some testimonials from manufacturers and some of our numerous customers. I promise it to be an exciting show this morning, so we'll appreciate if you can stand by to the end of the program. Going straight to the speaker session. Thank you for joining us. You're welcome. Wale Doherty, thank you for joining us. Please, like I mentioned earlier, we're taking a virtual attendance. Kindly drop your information in the chat box below. That is your name, your email address, your contact telephone number, so we can reach out to you after now. Our first speaker for today is Professor Bosade B. Afolabi. Professor Bosade Afolabi is a professor of obstetrics and gynecology trained in Nigeria and the United Kingdom. She is a maternal medicine expert, and her doctoral thesis was on cardiovascular aspects of pregnancy in sickle cell disease. She is a lead and co-investigator of several research grants. She's published 63 peer-reviewed papers and was featured on CNN Africa Voice for her work in sickle cell pregnancy and maternal health. Professor Bosade Afolabi is the current head of Department of Obstetrics and Gynecology at the College of Medicine, University of Lagos, one of the oldest and most renowned medical schools in Nigeria. She's a fellow of the Royal College of Obstetricians and Gynecologists in the United Kingdom and of the Nigerian Postgraduate Colleges, West African College of Surgeons, and the National Postgraduate Medical College of Nigeria. She also has a certificate in epidemiology and biostatistics from Harvard School of Public Health, Boston, in the United States of America. Professor Afolabi has mentored more than 20 young obstetricians and gynecologists some from medical schools level, student level, all of whom are successful consultants with 8 in academic posts. As a clinician, she has a great deal of experience in labor ward management and practice, performs major and minor gynecological and obstetric surgery, and trains resident doctors in all these to become competent gynecologists. She is also competent in and performs minimal access surgical procedures, including diagnostic and operative laparoscopy and hysteroscopy. Professor Falabi sits on the board of several hospitals. She's a PhD examiner and supervisor and is an assistant editor of the Journal of the West African College of Surgeons. Professor Falabi, good to have you on the program this morning. Good morning, you're welcome.
Good morning. Thank you very much for the kind introduction.
You're most welcome. Our second speaker this morning is Dr. Atinuke Oluwakemi Olaleye. Dr. Atinuke Olaleye is a clinical researcher and medical doctor with over 10 years experience in clinical management and health research in Nigeria. Our research areas are focused on reproductive health and as well as maternal and child health, including infectious disease prevention, treatment, surveillance, and control. She's a specialist obstetrician and gynecologist who is also highly experienced in women's healthcare, clinical research, and project management. Dr. Olaleye is a career development fellow and grant recipient of the European and Developing Countries Clinical Trials Partnership, EDCTP, conducting clinical research on malaria in pregnancy. Dr. Olaleye is also the Nigeria team leader and site investigator for the NIHR Global Health Research Group on preterm birth prevention and management, which is based at the University of Sheffield, United Kingdom. Dr. Olaleye is also a WHO TDR Clinical Research and Development Fellowship Ambassador. She currently serves as the Director of the Center for Advanced Medical Research and Biotechnology of Babcock University, Nigeria. Dr. Olaleye coordinates a team of highly trained scientists and support staff on the design and execution of various research and capacity strengthening projects. She's a senior lecturer and consultant obstetrician gynecologist at the Babcock University and teaching hospitals, respectively. She's also the medical director of and CEO of Samedea Clinics, a women's clinic and fertility center in Lekki, Lagos, Nigeria. She's a recipient of institutional and international research grants and has also received several academic prizes and awards at undergraduate and postgraduate levels. Dr. Olaleye bagged a medical degree from the Obafemi Awolowo University, Nigeria, from where she also obtained a Master of Public Health degree. Dr. Atinuke Olaleye holds the Postgraduate Medical Fellowship of the Nigerian Postgraduate Medical College of Nigeria. Sorry, I'll take that again. Dr. Atinuke Olaleye holds the Postgraduate Medical Fellowship of the National Postgraduate Medical College of Nigeria and the West Africa College of Surgeons, Obstetrics and Gynecology. She is happily married with children. Dr. Olaleye, you're welcome to the program.
Thank you very much. It's a pleasure to be here.
Thank you. So our discussion this morning, we'll be looking at the topic OBGYN as related to COVID-19 pandemic, the effect of COVID-19 pandemic on OBGYN practices. So you're welcome. Thank you for joining us, our audience, our participants. We're glad to have you on this program this morning. So like I mentioned earlier, there's a chat box below. We are taking a virtual attendance. Kindly fill the information that we need, and that's your name, your email address, your phone number, and the chat box below. It helps us to keep the records that you attended our virtual exhibition, and also we're offering a 10% discount on all of our products. So when you come to claim this, we need to match this information with your name. So please do so as we continue this discussion. All right, so Professor Afolabi, I would like you to set a basis for this discussion this morning. So I want to ask you, COVID-19, yes, a lot has been said about COVID-19. We've heard a lot and it cut across, every field in the medical field. So I want to find out, what are the major lessons that you have learned, in the OBGYN section, and then COVID-19, what effects, what new guidelines, do you have? What are the effects of COVID-19? What are the lessons learned?
Your question. It's nice to be here with Atinuke, who is a mentee who is fast becoming my mentor. Thank you for inviting us both. So regarding the lessons learned, basically, it's one of the major things we've learned is that we must never forget that pregnant women will remain pregnant and will always be there during any pandemic, and we must remember to prepare for their care. We were caught blindsided when the COVID-19 issue came in, and if not for the fact that the leadership of my hospital was very quick in making sure that we kept working and keeping things going for all our various departments, it would have been disastrous. As it was even a bit difficult because pregnant women themselves didn't have the information necessary to come to hospital. So one of the lessons learned was that we have to ensure that we're always prepared to look after our women at any given time, regardless of what the health situation is in the country. Another lesson learned is that leadership, appropriate and very, very forward, progressive leadership is key. And it has to be leadership by example. So to solving some of these problems. So those are the two major things. The effects are, so many that we can't start talking about them here, but the most important thing is, one, ensure that the leadership of any system is a progressive one and is by example, and that helps significantly. And two, that, preparations, always have a plan B for your pregnant women at any given time.
Thank you so much, Professor Falawi, for that. Dr. Alale, I don't know, can you share your thoughts on this as well?
Okay, thank you. Before I share my thoughts, I have to, first of all, also mention that I'm still and always will be Professor Falawi's mentee. She's been a really great mentor, and she has this passion to ensure that we keep moving forward. And based on her contributions and her help, we can see that I'm actually here as well to be able to have this discussion. So it's a great privilege, really, and an opportunity to be here with her. So thank you very much, Prof. Well, the key things have been mentioned, which has to do with preparedness, and of course, the leadership part or coordination. So just a few things I will add that have also been lessons learned have to be with the issue of safety consciousness. Many times we have a lot of documents, a lot of protocols, we discuss these things, but we don't implement them because we don't think that there's a problem, because the problem hasn't come up. And like Prof rightly said, we were blindsided by the COVID issue. But the truth is that if we have always had that safety consciousness, we talk, for instance, about universal precautions, but many times we don't do that, even though we know they exist. So this has been a very, very big lesson in remembering the necessity of this safety consciousness, and also the importance of implementing whatever we have put down on paper. Then the part of the simulation, the drills, as part of our preparedness, we have also realized that this is very, very important, because as much as we practice on these things, even when they haven't occurred, when they happen, it's easier for us to work together. Then another lesson learned is the importance of interdisciplinary relationship, having to work with multidisciplinary teams in managing pregnant women in this era of the COVID matter. So it's been very important, and has brought a lot to fore that it's not a one-man show in handling such issues. And finally, I would mention one thing that also was a big lesson learned is that telemedicine is possible. It is possible to actually speak with clients, talk with patients, get some information, even without them getting to the health facility immediately. Before it seemed as if, oh, you can work anywhere else, you can't work here, but we've seen that it can work. So thank you.
Yeah, thank you so much, Dr. Olale, for that. Yes, telemedicine. Yes, I know. I was able to use that also as well during the pandemic. So I will ask you this next question, and I would also like Professor Falabi to share our thoughts on it. But before I do that, thank you for joining us, Dr. Shuemimo. Uzo Owunali, thank you for joining us. Please, we are taking a virtual attendance. On the chat box below, kindly fill your details, that is your name, your email address, and also your contact number, so that we can contact you after this program. So to our next question, Dr. Olale. So during COVID-19 pandemic, there was a significant drop in the attendance, for non-emergency cases. What were the strategies used to ensure antenatal services were uninterrupted during this period? And this question is very personal. I will explain myself later. Let's hear your thoughts, man.
Okay, yes, you are very correct. There was the drop in cases coming to the hospital because of the COVID-19. Definitely, as the first part being the fact of there wasn't enough information anyway. So people were worried and scared about if I enter the facility, something, I will just catch COVID and things like that. And of course, the fact that apart from the public, even the healthcare workers were not very clear on what was happening. It was a rapidly evolving situation, and even information, literature on what needed to be done or how to manage COVID was scarce. So even antenatal was a part that was affected as well. But one of the things that we tried to do was, first of all, putting in place the necessary protocols for triage and also for ensuring safety of the people who come to the facility. So ensuring, for instance, we have the screening questions to be able to know if there is a risk of COVID for the person coming in, and what to do. So the training of staff on what to do with respect to triage, what happens if there's a suspicion, what happens if there is no suspicion, how to go about that. That was very important. Also taking the necessary measures with respect to the hand hygiene, face mask, and co. These are things that also help to give patients some confidence when they come to the facility, knowing that some steps are actually, active steps are being taken for their own protection as well. Then a lot of information had to go out, information dissemination through various groups, the social media, direct speaking, patient leaflets, all these things had to go out so that people are also aware of the fact that this exactly is what the situation is. And so things are not blown unnecessarily out of proportion. Then a lot of of what we had to do also had to do with communicating with the clients, even via the phone. That's why I was talking about the issue of telemedicine, telehealth. In some instances, we had to do that, actually talking with clients so that they are aware know what their situation is, and then to determine those who need to come to the facility, or those who do not need to come to the facility at that point in time. So booking appointments as well was now something that we had to do, so that we don't have crowd, congregating, which was the usual way we used to do. So that has also changed some of our obstetric practice in that regard. So before, it was relatively difficult to get people to do appointment bookings. People just say, I'm going for a clinic, I just go. But with this, people are ready to say, okay, you are booked for so time, and then you come at that time, so that we can work on ensuring that there's enough distancing and people can be attended to easily. So initially there was that significant drop, but with time, people started also going along with these adjustments, and it's helped a bit.
Thank you so much for that. Professor Falabi, please, let's share your thought on this.
No, Tonika has said it all. There's nothing to add to that. We can move on to the next question.
Okay, so because part of what you mentioned, I remembered, during that period, they didn't attend to my wife. She went to the, for antenatal, and they sent her back. She was very angry that I told you I wasn't going to go. You asked me to go. So part of what you said, yes, that's true. Thank you. So moving on, please, if you have any questions for our speakers, you can drop them in the chat box. We'll take them as this discussion goes on. So the next question, this is for you, Professor Falabi. Patients with suspected or confirmed COVID-19 cases, do they need any additional antenatal or antenatal fetal surveillance?
For the confirmed cases or suspected cases who are symptomatic, they probably would need more antenatal surveillance, especially for the baby, because we know that so far, for the information we've managed to gather from the data that's available, we know that preterm delivery rate is higher in COVID-19, or at least is high in COVID-19 relatively. We also know that we've had incidences of stillbirth with them. We've had incidences, although we are not yet sure if it's higher than the general population, but we know that that is also possible. So we do need to monitor those women who have COVID-19 a bit more, especially the ones who are symptomatic. That is, who have, maybe the fever, the cough, the breathlessness. They need to have even some extra monitoring.
Okay, so Dr. Olale, do you have, you want to share your thought on this one?
Oh, well, Prof has been in the forefront of actually doing active management of COVID-19 pregnant women and their deliveries and co. So I totally concur with everything she has said. I have nothing more to add on that.
Okay. So, Prof, I will ask you this. Let me ask you this one. Delivery timing, it is believed that COVID-19 symptoms get worse in 2 weeks, after contracting exposure or probably confirmed case. I want to ask, does this affect the delivery timing for patients with mild symptoms? Do you ask them to come in early enough?
So that's an interesting question. So what we did most of the time, whenever we got that call that there's a new COVID-19 patient coming in, all of them came in the third trimester, that is in the last third of the time of pregnancy, from about 30 weeks onwards was when they came. And what we always tried to do initially was to buy time. So we know that within those 2 weeks, the patient would usually test positive and then eventually get negative. So if the patient was positive and she came into the center and she wasn't having a lot of symptoms, or she wasn't very due, as in maybe like 38 weeks or so, we bought time, we waited, and she was monitored in the isolation ward, and we waited to see if they would clear. So in 1 or 2 cases, we actually had the patient becoming negative and being able to be discharged from the isolation ward without even delivering with us in the first place. But when it comes to patients who become symptomatic, there was one woman who was so very ill that we had to deliver her the next day because she had really severe symptoms. She was in respiratory failure after being with us for 1 day, even though she was not yet full term. She was about 35 weeks pregnant. We delivered her then so as to be able to resuscitate her better, because she was really, really oxygen dependent and very, very sick. Luckily, we managed to save her life.
Wow, good job. Well, that's a great one. Well done. Dr. Olale. Dr. Olale.
Yeah.
Okay, you there. All right, this is for you. I don't know if you need to share your thoughts on that as well, you can, but this question is for you. How do you handle the situation when a pregnant patient with suspected or confirmed COVID-19 case is admitted and birth is anticipated?
Yeah, well, I think that's almost like a continuation of what Prof was just talking about, because she had already started from the patient being admitted and what is being done. And like I said, she's been handling the actual deliveries of COVID-19 patients, so I would respectfully pass that to her.
What was the question again? Repeat it, please.
About handling delivery.
Yes, delivery
COVID-19 patients.
for COVID-19 patients. Yes.
Okay. So I just want to bring up at this point that when we say I've been handling, I was the leader of the team. I did directly care for some of the patients, but the team is a large team. We called ourselves the maternal and newborn care COVID-19 team in Luth. And they were exceptional. It was a team made up of, just as Dr. Lale alluded to earlier, obstetricians, theater nurses, neonatologists, anesthetists, engineers, technicians, even admin staff, hematologists. At some points, the respiratory and the cardiology teams also joined us. So we had a WhatsApp group of 32 people, constantly, discussing and, talking about how to look after these women. So, and everybody was exceptional. In fact, one of the technicians, when that very sick woman was on admission, he slept in the theater throughout her admission, and she was on admission for 22 days, because he was the best person that knew how to change any gauge onto any oxygen cylinder, as required. And he was crucial. So he just did that. So, and he was crucial to this woman's survival, because if we had at any time not be able to change the oxygen cylinder, quickly, she used maybe about 30 or 40 cylinders of oxygen in total, to save this woman's life. Anyway, back to the main question, which was about how did we plan the deliveries and take the deliveries. So when, like Dr. Lale also said earlier on, the simulations for the first case that we had, she came in, we knew about her on the Friday. She actually came in on the Saturday. And from that Friday, we had started planning. We had formed the group. On Saturday, when she came in, we had a meeting of the key people, the obstetricians, the theater nurse, the anesthetists, and the neonatologists. And we had an admin and our core Luth admin. CMD, CMAC have been fantastic, and deputy CMACs as well. So we had a meeting just to plan on Saturday. On Sunday, we came in for a simulation, to work, because the isolation ward was remote from the theater. Not when I say remote, it was just separate. So it was on the same floor. So we had to move the patient from the plan how we would move the patient from the isolation ward down the corridor to the theater. And also when we got to the theater, how we would do the flow of the theater, which entrance the patient comes in through, where the obstetricians will come in through, how to make sure that we kept the dirty area dirty and the clean area clean, and to walk through in a particular manner. Everything had to be planned. We had to plan the pack system where all the consumables and drugs the patient would need would come in one pack from the pharmacy, so that we're not going in and out of the theater looking for more equipment and possibly contaminating others. So that was done. We also had to plan, the blood products if we needed blood products. At that time, people were still worried about whether blood would transmit or not. So we didn't want to necessarily send the blood to the blood bank or collect blood from the blood bank or anything. So what we did was to have her type-specific blood available, any of the patients in the blood bank, such that if at any time we needed the blood, we just say, okay, please send the blood up to the theater. This is going on at the moment. But luckily for all the 9 cases we handled, we didn't need to transfuse any single one of them because we really planned seriously for not losing too much blood. Even 1 or 2 people that lost blood, we had ways of making sure that we didn't need to give them blood because we had tested their blood ahead, and we gave them, we used tranexamic acid and some other, and carbetocin and other oxytocics that we made sure would reduce their blood loss. So the planning was very key. And even though this would answer one of your questions, cesarean section is not indicated for COVID-19. We had to do cesareans for a lot of them because of extenuating circumstances. A number of them had previous cesarean sections, and another few of them that were symptomatic and needed urgent delivery. There was only one maternal request. She just said, look, I don't want, and she was our book patient, I don't want to go through this idea of maybe induction or whatever. She was already 39 weeks. She was with us for about a week and a half. And when she was 39 weeks, she said, look, I don't want to go through induction. Please just go ahead and deliver me by cesarean section. And we acceded to that. So out of the 9 cases, 8 of them were delivered by cesarean section, and it was just 1 that was vaginal delivery. So we had to do a lot of planning, basically, in order to do each delivery. But as time went on, it took less time. The first case took us 3 days to plan. After a while, the patient comes in and, within a few hours, she's already due for delivery, and we go ahead and do her delivery.
Wow, thank you so much for that very incisive contribution. You've been able to answer 3 questions just by even talking, speaking that way. I don't know, Dr. Olale, do you have any thoughts to share? Any contribution on this before we go to the next question?
Yeah, the thoughts I just wanted to reflect on had to do with, you can see from the description that Professor Afolabi gave on what was involved and who the people that were also involved in ensuring that these patients were taken care of and were able to have safe deliveries, and also ensure that other patients in the facility were not exposed, you understand. All these things they have a lot of impact with respect to the personnel you require, the facility, and how things flow. And so that just brings me to look at the issue of when we talk about managing COVID-19 and pregnancy, especially with respect to delivery, it's not likely that it's every facility that may be able to do that. So it's also important. One of the key things to note is also knowing how to ensure that your facility is actually able to provide that kind of care and protection, not just for the patient, but for the staff and for other patients. I know Professor Falabi she's made this presentation on preparing your maternity facility for COVID-19. And I think it's important for people to note that before, going ahead to plan or to do these kind of things or to handle it, one should take time to ensure that the necessary personnel, equipment, and infrastructure is in place to make sure this becomes, something, a safe procedure for all concerned.
Indeed, indeed.
Thank you so much, Dr. Olale, for that contribution. So if you're just joining us, you're welcome. Kindly fill your details on the chat box below. We're taking a virtual attendance. And also, if you have any questions for our speakers, you can drop them in the chat box. We can ask, during the course of this discussion. And also, we have attached for you a product catalog, some promotional product catalogs that you can download to view some of our products. We are applying a 10% discount on all of our products during this period. And also, we have extended that till the end of October 2020. All right, so moving on. I would like to ask you, Professor Falabi, this question. I remember, during when COVID-19 was very, very, high. We have high rate in in Lagos, especially in Lagos State. I remember that every now and then they disinfect the hospitals. And moving pregnant women from one floor to another seems to be very, very hard. You move some with their babies, move some with, with their heavy pregnancy. Moving from one location saying they want to disinfect this place, so you need to move to the next floor or something. So how did you manage this, Professor Falabi? Let's hear your thought on this
So moving patients from one place to the other, how we manage this?
Yes, disinfecting, the facilities. What does it entail? How did you manage it? I witnessed one that, patients were moved from one floor to another. They had to carry their bags. The nurses keep coming and going back, very hectic. So I just want to share your thoughts on this one.
Yeah, it was mainly the combined administrative, it was an administrative thing, more or less, not necessarily clinical. So the nurses were very involved. The microbiology unit and infectious diseases unit too were involved. So what happened, and of course the cleaners. So the patients were, so for example, there was a time we moved a patient from from the labor ward to the ward above because we wanted to decontaminate the labor ward, as it were. And so they managed it by moving the patients into the lift and moving them upstairs. And then the concerned ward was disinfected. All the surfaces were wiped down, which is the most important thing really when you're trying to disinfect. You need to actually wipe the surfaces that people touch down properly, and all the equipment, that are used on patients also, to need to be wiped and cleaned properly so that it will reduce the transmission rate. It doesn't mean that once somebody enters, they're not going to contaminate those surfaces again. So wipe and rewipe and clean and reclean are things that one needs to do when one is trying to do proper infection prevention and control.
Okay, so Dr. Lale, you want to share your thought on this one? And also, I want you to take this PPE management. So, how were you able to, handle PPE management? There were considered to be a lot of shortage of PPE, coverall, face masks, and the likes. So, how were you able to also manage that? Share your thought on what the prof just said, if you have any contribution, and also, this question before we move to the next one.
Okay, with regards to disinfection issues, well, there are things, as Prof mentioned, there are some policies that are already in place for general disinfection, fumigation, and co that takes place at specified or scheduled times. But in addition to that, one of the things that also helps is at the point of triage, we're being able to also ensure that we are able to put maybe if you're having like a holding area or a containment area, or sometimes what we call like or in confirmed instances having an isolation area, which I know they also had that they did during the management of the COVID cases. If you have an area that is already specified that you put your high risk or the confirmed cases in, then it's we try to avoid cross-contamination as much as possible. So the levels of disinfection and also the PPE required for accessing these different areas will vary. I'm actually answering your second question as well as I'm answering this first one. So what I'm trying to say is that the use of PPE is dependent on the exposure risk that is anticipated for the personnel who is going to wear it at that point in time. So one of the ways of being able to also ensure the rational use of the PPEs so that we are always short of PPEs is to be able to more or less delineate areas better so that you can say these are the real areas you call the dirty areas, these are the areas you call the clean areas, and then it's helpful to do that. Now, one very important thing for PPE also had to do with the part of information and education for people to also understand that it's not, there's a PPE is in different ways or different levels. There's a level 1, level 2, level 3, depending on what classification you're using. So knowing what PPE to be used for a particular procedure or for a particular thing. For instance, if you are seeing a client or attending to somebody at the triage place and open, maybe you have just a canopy and open airspace where you are triaging people by asking screening questions. Everybody is wearing a mask. You may not need to, you don't have to have a TVEC suit with a respirator on to do that. If you wear that, then you are depriving those who will require it, probably for doing surgery or something of that. So I think the key problem, one major problem we had initially was people knowing the appropriate PPE to use for specific procedures or things that were to be done. But once that was clear, then it was easier to be able to say, okay, this is necessary, this is available for this use or for that use. It was not the case of, oh, why are you wearing full gown? I am wearing surgical mask alone. I must be, it was not a competition. So that was very, very important to note. But despite that, we do know that we have issues of shortages. But where we are able to triage our patients well, it's helpful as well, so that we know at what point patients that are going into the holding area, containment area, anybody, healthcare workers who are going to attend to them know that, okay, you have to do so and so things. If you are just in the outside triage area, this is what you wear. If you are going into the isolation unit specifically, where there is a confirmed case, this is what you need to wear. So that has been helpful. But I must say that there is still shortage of the high-end PPEs now with respect to the level of the main suits and co. But really what led to that sometimes was the issue of this misuse of PPEs.
Thank you so much, Dr. Lale. Professor Falabi, do you have any contribution on this?
Yeah, I do, regarding the PPE issue. So I'll speak about the availability as well as the actual use. In terms of availability, everywhere in the world, there was a PPE shortage, so one really had to be strategic and careful. And that was one of the areas where leadership did make a difference, because both the upper management of the hospital, as well as I myself as the head of department, went all out to try and get PPEs any way we could. So I know that we had a lot of donations. I specifically went out to a couple of the groups I belong to, cap in hand, and said, my people, please don't fall my hand here. I beg. I head this department. I want my doctors to be able to continue to work. Help me. And I got a great deal of help. I'm so grateful to my old girl Queen's College set, class of 85, as well as my IFE. We have this group that we entered IFE the same year. They're not just doctors, they are doctors. In fact, there are very few doctors on it. Most of them are, I think, were the ones that enjoyed IFE the most the year that I went in, and we kept together for a while. And because we didn't always go straight to the hospital or away from the main campus in IFE as medical students in that time, we managed to, associate with non-medical people for a while. And so I don't want to use the word that we rocked together, but I think you kind of understand what I mean.
Great
So
exactly.
they're all really, we have a group anyway of over 100 people, and they came out all out and really helped as well. So I'm really grateful to them. So we didn't have issues in my department with PPE for general care, but for the actual COVID-19 patients and for people that you had to operate on, there was that demand of, I want 1095, I want 1095, when you don't necessarily need it. You only need it really for either confirmed cases or cases that you're going to do GA on, and because you have to assume that anybody may have COVID, and they say GA causes aerosols to be emitted. you need N95 for those. So you need to really be clear, and that's one of the reasons why you have to do the training, to be clear what you need some of these PPEs for. Incidentally, these TVEC suits are not really necessary even for confirmed COVID patients. You really don't have to wear TVEC suits. Those complete, they look nice, but they're very hot. I have a colleague in Ireland who used to be the master, they call it master, but really the head of a very, very busy hospital in Dublin. And they deliver about 8,000 babies a year easily. And she said that in her hospital, nobody used TVEC suits for COVID-19 patients, that they didn't even know how to put them on and they didn't want any trouble. So they used their usual impervious outfits. I know that people will say at least they have negative pressure theater and blah, blah, but truly COVID-19 is spread by droplets and, contact from contaminated spaces. It's not, it's not one of those things that enters your skin or anything like that, So you don't need TVEC suits, for that. But people still felt they did. And a lot of especially at the beginning, there was a lot of overkill in type of PPE you need. If you're going to put people out there to do conditions, I couldn't argue, So we needed to try and make them feel comfortable. As time has gone on now, it's reducing, and people are not insisting that much on full kits for even cases that are not confirmed, that just the general population now. So that PPE issue is a very important one. And it's something that I'm hoping that as time goes on, it will get easier and better, because the cost often has to pass on to both the hospital and the patient. And it's unsustainable, especially in Nigeria, where we don't have that good a health insurance package. Thanks.
Thank you so much, Professor Falabi, for that contribution. So moving on, before we do that, if you're just joining us, welcome to the program. We're glad you could make our time to join us this morning. We are taking a virtual attendance. Please, on the chat box below, kindly fill your details. That is your name, your email address, and your phone number, so that we can contact you after now. Also, we have shared a link on the chat box, link of our promotional product catalog. We're offering a 10% discount on all the products that are displayed on the catalog, as well as all of our products, if you make purchase between now and end of October. So kindly write us if you have any question for our speakers, so that we can take them as we go on in this, discussion session. And also, if you have any inquiries from the company, you can also drop your message or contact us through our contact phone numbers and email that is displayed in the chat box. All right, moving on. We're coming gradually to the end of this discussion session, but that's not the end of the program. The program still continues. Professor Falabi, I will ask you this question, maybe before you leave us. For deliveries, during COVID, you don't need to keep patients, in the wards. You try as much as possible to reduce the number. So how long are patients being kept after delivery, especially those of cesarean delivery? So do you feel the urgency to discharge them early due to COVID-19? Please share your thoughts on this.
At the beginning, we did. Things are easing up a bit now. People are, taking COVID in its stride, especially since it is reducing. But at the beginning, yes, we did. Generally, these days, we do try and discharge patients earlier from cesarean section anyway. So within 3 days, patients have usually gone home, even from teaching hospitals where, because we don't, the cost of beds, admission days is not as high. We tend to just forget and keep patients there. We used to keep patients, for longer than they really needed to be. But these days, that has reduced even before COVID-19. And with COVID, yes, as soon as we could discharge patients with cesarean section safely, we did. So we had surgery day plus 2 or 3 other days. We would discharge most patients once they're stable. Yeah, basically that's it in terms of delivery. And for normal delivery, delivery day plus 1 or 2 other days, we would discharge them, especially for the people that have delivered in the past.
All right, thank you for that. Dr. Olale, you share your thoughts on this if you have a contribution, but I would like to ask Prof before she leaves. Somebody have a question. It says, how did you handle the initial panic among healthcare workers before you could get that good number to be on the team?
Yes, that was a very interesting one, and it was a combination of just cajoling and then being there. So what I was particular about was for my consultant colleagues to remember that, you know, we were the head of the team. We were the ones who the residents were under. We were the ones whose names were on the patient's case notes. And I just, you know, appealed to them and had many meetings with them. We had a lot of meetings, and my colleagues were very cooperative. And just by talking through it all the time and ensuring that we were there and, you know, running our clinics, doing surgeries. In fact, for the first 6 or 7 surgeries, it was consultants that were doing them. It was only for 1 or 2 that a resident also joined the actual surgeries. So just that being there and showing that, you know, I myself wasn't afraid to be in the fray. It helped, I think. Having meetings, their own collaboration, their own, you know, support really helped, you know, with the fair. The residents as well, I just showed them that I was ready to be there all the time. They could call all the time. And the other consultants also did so. And that helped, in fact, including making sure that their call room was, you know, redone and, you know, giving them cleaning materials, getting serviettes there for them to clean their hands after washing their hands, all those little things, you know, sprays for, you know, sanitizing the place, just constantly doing all that was necessary and being there really, really helped. And I think that was what helped quell the fear. In fact, there was one point during the lockdown that, you know, we were trying to get, what's it called? One of the matrons said, look, they would like food. And we made it happen on 1 or 2 times, just so as to motivate and help people feel more, you know, involved and to want to do stuff. So yeah, that really did help.
Thank you so much. That question was actually from Dr. Jegede. Thank you for that contribution. Dr. Olale, you want to share your thought?
I think we're talking about initially about discharging patients after surgery and co. And I do agree with Professor Falabi. We have been doing that like post-op day 3, usually about that if everything is fine. So even before COVID, that had been happening. So I think there's nothing for that to add on that. Thank you.
Okay, thank you. So moving on, Prof, thank you so much. Thank you for standing by. I would like to ask, can a mother with confirmed COVID-19, can she breastfeed her baby? And if yes, so what are the guidelines? What are your advice? I would like to start with you, Dr. Lale, and then Prof can share your thoughts.
Okay. Yes. So regarding breastfeeding and COVID-19, it's not been shown from literature, at least up till now, that COVID-19 is transmitted through breast milk. It hasn't been proven from literature that is happening. However, it's the decision on breastfeeding for the patient who is COVID-19 positive has to be a shared decision-making process. Usually, this is because of the fact that for a patient who is COVID-19 positive, within the usually once these 14 days where you're talking about to see when she turns negative and things like that, some advocate that you separate the baby so that the baby does not get infected. But there are others who have also advocated the fact that, look, for the breastfeeding process, the bonding process is also quite important. And as Professor Afolabi already mentioned, it's an aerosol transmitted infection. So what you really want to ensure is to prevent the aerosols from the mother getting to the baby. So there have been what could be done. We ensure that if the mother is going to breastfeed, she has the surgical mask, she has a mask on to ensure that there's no droplet transmission. And of course, the hand hygiene, all the necessary things that need to be done definitely still have to be ensured so as to reduce that risk of transmission. There have also been instances people could choose and say rather to express the breast milk initially and then give the baby pending when the mother tests negative. So I believe that it's a case by case basis. It's not really a one size fits all depending on what is going on at that point in time. Also, it also depends on how the baby is. If the baby requires neonatal intensive care or some other things for one reason or the other, that also influences this decision on what will happen. So it needs to be individualized, but taking note of the principles we are working with, which is the fact that you are trying to ensure that you don't have aerosol from the mother, the droplets going from the mother to the baby during the period of the breastfeeding.
Okay, thank you so much, Dr. Alale. So, Prof, so I think Prof needs to leave us now. So I
Yeah, I
want you to
do.
react to that, and then just give us a closing word so we can let you go while we continue with Dr. Alale.
What aspect of the question? Can you repeat that last question?
We're asking if your mother with confirmed COVID-19 case can breastfeed her
Oh,
baby.
right. Okay. Yeah.
Right?
No. I mean, basically, it's not. There's no evidence, just like Dr. Lala said, of it being transmissible by breast milk. It's not been found that there yet, and all our patients breastfed, and none of their babies got infected. So the important thing, though, is like she said, mask when you're breastfeeding and sanitize before and after you pick up the baby. My last words basically is just that just as I've always, as it's always been from the word go. For some reason, I wasn't panicked with COVID-19. Having said that, that's just the average general. There were times when I did have, times when I was afraid, but overall, it wasn't something that made me feel, the end was coming. I just felt that it was something that I literally followed the figures, and the science was that fine, this thing is very infectious, but it wasn't killing people to that extent. Now it's easy for me to say that because I know that people have lost, important people to them, and I don't want to treat that lightly at all. But if you look at the figures say that the case fatality is, even in the worst places, 3 to 5%. And it's affected more of people who were elderly. I mean, the deaths were more in older people or people with comorbidities. So because of that, it never really made me feel that panicked. Luckily, as time went on, people have seen that, even people that have acquired it. I had a lot of colleagues who had the condition and they all got well. Some had bad symptoms, and of course that would be scary, but they came out of it in the end. The important thing to note is that this thing is not a death sentence. And for that reason, we as health practitioners, we need to be ready to protect ourselves. And once we've done that, to look after our patients. Pregnant women are not going anywhere. People will always get pregnant, and we owe it to them to look after them properly during this time. So we need to not let our guard down, continue to protect ourselves. As these days, people are, even myself, I have to admit, sometimes I'm not as, I forget I'm out of the house before I remember I haven't worn my mask, and then I have to come back and wear it. In those days, I was wearing one shoe throughout for about 3 months, just so that I wouldn't bring in. But we've realized now that shoes don't tend to, transmit the thing as much. It's one of those myths. So my last point is just that we have to remember that as healthcare practitioners, we owe it to our patients to look after them. Of course, feeling safe ourselves, so protect ourselves. But after we've done that, make sure that we don't turn patients away, we don't stigmatize, we don't make patients die of something else apart from COVID-19, and look after them responsibly the way that we have given an oath. I
Thank you so
think those
much.
are my last points. Thank you.
Thank you so much indeed, Professor Afolabi. Thank you for your time. I know you have to get on to probably another meeting now. We're so glad you could make it to the program this morning. Thank you for sharing your thoughts. We're indeed very grateful. Wish you all the best, you and your team. Wish you more success. We pray that this COVID-19, the effect will be reduced and permanently removed from among us. Thank you once again. Enjoy the rest of your day.
Thank you.
Thank you. So moving on, Dr. Lale. So before you give your closing words, I would like to ask, so how can, and of course, during your closing words, there are some people that don't believe that COVID-19 exists. So I want you to, even till now in Lagos State, so with all the effects and across, Nigeria, I would like you, what message do you have for them? But before you do that, that will be part of your closing word as well. I want you to note that. I want to ask, how can an obstetrician gynecologist help a pregnant and postpartum patient with suspected or confirmed COVID-19? How can you help them to manage stress, anxiety, and depression?
Okay. Well, it's the key thing is that pregnancy on its own, and of course, just having a baby, there are already stressful situations. So it's important to, first of all, understand and acknowledge that. So COVID-19 is now an additional stress on what is happening. But the key things that are important, there are two aspects to that stress now, because it's not clearly stated in the question. There's the anxiety or stress of, oh, I'm worried that I may get COVID-19 or my baby may get COVID-19. Then there's the worry and the anxiety of, I have COVID-19 and I am pregnant, or I have COVID-19 and I just had a baby. So there are two slightly different things, but in all, the obstetrician has to, first of all, definitely show empathy. It's very important to let the patient understand that we do, empathize with them. And it's very important to ensure there's appropriate support, psychological support, social support. You want to know what support mechanisms they have available as well, both if they're at home or whether within the hospital and things like that. But one key thing that also has a lot to do with anxiety or stress is information. Many times we stress over things because we really don't know. We don't know, we cannot really say for sure what is happening. We don't know the true facts, we don't know what the science says, and then we panic and we worry. So it's very important for us as healthcare practitioners to be able to provide accurate, up-to-date information to our patients so that we help to alleviate some of the worry or the anxiety they have. It's also necessary where it's necessary, where necessary, we should be able to also link them with professional support or counseling or help, and then help them to also identify what can help them with regards to social support, whether at home, and also what are the issues for those who already have COVID and are worried. We need to let them know, okay, this is what the science says, this is what we need to do. And like Professor Afolabi rightly mentioned, we let them understand the facts as well. Yes, COVID is happening, but it doesn't mean it's a death sentence. These are the chances, these are the things that tend to happen, these are the risks that you face. These are the ways we can help to mitigate those risks. Having those discussions, carrying them along in our discussions and our management goes a long way in alleviating anxiety and stress, because many times they just feel like we are just talking to them rather than talking with them. So I think that's very important for healthcare practitioners. Let's carry our patients along in whatever it is we're doing and provide accurate and up-to-date information as much as possible.
Thank you so much indeed. Thank you, Dr. Valere, for that.
Thank you.
So how is it like for those that don't believe that COVID-19 exists?
Well, I would just say that for HIV too, it took a while before people believed HIV existed. But I think now there will be hardly anybody that will say HIV doesn't exist. So I think it's in a similar fashion. eventually they will understand that COVID does exist. I think because of the fact that it's not as widespread, or the numbers are not reflecting as high in Nigeria, maybe that's why people don't assume or believe that it exists. But I think it's important for everyone to know we need to protect ourselves, protect our elderly people at home with us. Even if you don't have symptoms, if you don't protect yourself, you can acquire this and take it back to your loved ones at home that may be at higher risk for it. So if you don't do it for yourself, do it for your loved ones, please. It's important. Let's be protected. Thank you.
Do it for your loved ones, indeed. Thank you so much, Dr. Lale, for coming on the show. Thank you for your time. Remember, the show still continues. This is the interactive session that we're just bringing to an end. Dr. Lale, thank you for your time. Thank you for sharing with us. We do hope that you stand by. We have some other presentations we need to make before the end of this program. Thank you, and we hope and pray that you and your team, the Almighty will continue to protect you and keep you safe. And the good job that you're doing, your reward, you will get them in good measure. Thank you once again for coming on the program today.
Thank you very much.
Have a nice day. So we hope you stand by to the end of the program. We have some exciting exhibitions of products that we want to do right now. Thank you. All right. So moving on, we are the product exhibition segment of the show. And then today we have OBGYN equipment. Some of them we're going to be displaying them shortly. Like I said, if you're just joining us, thank you for joining us. We're glad you could make it this morning. We're taking a virtual attendance. Kindly drop your information on the chat box below. That's your name, your email address, and hopefully your contact number so that we can reach you after this time. Of course, we have a promotional product catalog that is attached on the chat box as well, where we display some of our products that we're giving special discounts on, up to 10% discounts on each one of them. Please kindly download that with the link that has been shared. And also, you can reach us if you need any of this. Again, I would like to also mention that we have extended the discount. We extended it to all our other products that will not be displayed today. So that means if you contact Mogbonju Nigeria Limited for any medical equipment, you'll be sure to get a 10% discount. And that promo runs between now and the end of October 2020. All right, so in this segment, we're going to be looking at some of the products that are being used in the OBGYN section of the hospital. And then I hope that it will interest you. And if you have any question or inquiries, you can drop them in the chat box below. We'll be able to take your request now or call us after now. You can also send us an email of your inquiries and we'll come back to you shortly. So let's have the video presentation. Hello everyone. Welcome to the Day 3 Medical Equipment Exhibition of the Mogbonju Nigeria Limited Virtual Medical Exhibition 2020. Today, we are going to be looking at obs and gynae equipment as related to COVID-19 pandemic. I'll see you shortly. Thank you. Here, I have equipment that I use for monitoring during pregnancy. Now, we have the ultrasound machine. This is a portable type of ultrasound machine. This particular brand is made by Ecomed. We also support other brands like Sonoscape and among others. So this is a portable type that you can carry either to the patient to site for the sake of ultrasound. This comes with a convex probe. Here we have the convex probe. You can also support the transvaginal probe and the linear probe as well. So here we have the ultrasound device for fetal heart rate monitoring. This is PDI ultrasound, made by Ultrasound Technology in the UK. This is a good quality brand. It comes with a display screen that can show the heart rate of the baby, and as well as give sound that the mother can as well hear. Here also we have another brand of ultrasound filter Doppler. This is made by Promise. This is another version by another manufacturer. They perform the same function to monitor the heart rate of the baby in the utero. So here we have the fretoscope, that's the fetal stethoscope. Although this is old-fashioned, but some people still prefer this to listen to the heart rate of the baby in the belly of the fetus. Here we have the CTG cardiotachograph machine. This is fetal track 360 CTG machine made by Ultrasound Technologies in the UK. This comes with twins monitoring function, and it can also monitor the contraction, that's uterine contraction of the mother. So this can be used for child monitoring as well as the mother monitoring. So it has papers, the printing papers that can be printed throughout the monitoring period. We also have the advanced type that has ECG function, so that you can monitor full function of the mother and also the baby. Here we have the electrical gynecological bed. This is a gynec bed with full function, electrical function. It has a remote control for you to control the height of the bed, control the head part of the bed, the leg part, and also adjust the bed from one position to another. This bed here is made by Medwise. Medwise is a company from India. And also we have another brand from the UK, Mediplant, that we also support. It comes with lithotomy poles and also the handbar and the side rail. The handbar here, which the patient can use during delivery. Now we have this model displayed already with the baby engaged with the lithotomy pole here. And that reminds me, we support different kind of delivery models and also teaching models for hospitals. So if you need anyone, you can contact us. So this one here is a pregnant woman model with the baby already engaged, ready for delivery. So as soon as the baby is delivered, if the baby needs any care at all or whatsoever, then the baby is transferred to the baby incubator here for further monitoring. I'll come back to this, but before then, if the mother needs any care or any form of evacuation needed to be done, then this part of the bed can be removed, and then underneath you have the roll underneath here. And also we have on my far left there the surgical instruments, gynae instruments for to be used for the mother in case it needs any form of procedure or operation. These are instruments, like I mentioned, are supported by our UK manufacturer, and we can give guarantee on them. They have 5 years warranty, each one of them. They are high quality surgical gynecological instruments. So back to the baby incubator. So once the baby can be put in the baby incubator, this baby incubator has height adjustment pedal here, which the user can use to regulate the height or adjust it according to the suitable working height for him or her. And here also, it has the baby probe and the air probe, and they can both monitor the temperature probe of both the baby and also the ambient air. This incubator also has the function of weighing scale, so you don't need to move the baby in and out of the incubator to take the weight measurement of the baby. So it has that function also included. It also has the power failure and low battery function, and also overheating alarm in case you need to quickly attend to the baby. And this is a phototherapy unit. We have different forms of phototherapy unit, different types, different brands. This is a particular brand which can also be used together with the incubator and also to treat the baby in case that is required. The baby incubator also has 4 drawers that the user can use to store equipment or products. So here is the baby weighing scale. After the baby is born, you need to take the weight measurement of the baby. Here, like we mentioned, we support Sika brand. Sika is high quality. When you need precision for health, then think of Sika products. So this is Sika 354 baby weighing scale with a baby bassinet here where baby can be placed conveniently and the weight can be taken. We have the Sika 354 mother and child weighing scale. This mother and child weighing scale, it has several functions. So I'll just mention a few. This is placed on the floor, and the doctor or the user don't need to bend over, to switch it on. There is a switch here where you can easily just use your leg by clicking, the machine will come on. And also it has 2-in-1 function, whereby the mother can have the baby with her, just carrying the baby, and the weight of the baby can be weighed conveniently. So some baby will not stay still while they use this baby weighing scale. So the mother can have the baby carried in her arm, and then while they both step on this, the weight of the baby can be measured. It has a function to deduct between the weight of the mother and that of the baby to be able to give you the weight of the baby, the overall weight and the weight of the mother to be able to give the weight of the baby. Special function for that. Mother and child scale, it has a carry bag and very good, very durable, high quality. It's also a Sika product. So for the clothing, we have disposable and reusable clothing. Here we have the reusable type, which can be autoclaved afterwards. But because of COVID, we recommend that you think of the disposable type. This is the thumb loop apron, and that is the coverall. We also have the doctor's gown, which can be used by the doctors or midwives, and also this can be used by scrubbing nurses. And then we have the full coverall, the PPE coverall, with all the complete accessories, complete PPE, which can also be used in the theater. So thank you so much. You can see some of the products we have highlighted for you for today's show. And also very shortly now, we'll be taking a video from our previous exhibition. Normally we organize this exhibition year in, year out. And because of COVID, we're unable to meet physically, and hence you have come online to do a virtual exhibition. And we hope you're enjoying it as much as we're doing. Let's take some sight and sounds from our previous exhibition. Just maybe you can see some of the products that interest you. And remember that we have a 10% discount on all of our products if you purchase them between now and end of October 2020. I'll see you shortly. Remember, we have special discounts on all these products that has been displayed if you buy between now and end of October 2020. And all our products, like I mentioned, have warranty. So moving on, we're going to be taking testimonies from a manufacturer and also from some of our numerous customers. But before we do that, I want to introduce to you the new Mindray Passport Patient Monitor. If you have a very busy emergency room or ICU, then you might want to consider these products. The video will be coming up shortly, but before we do that, you can download our promotional products catalog on the link in the chat box. You can download them and go through them. If you need any of those products, we'll be able to apply 10% discount for you. And also that has been extended to the other products that we distribute. I'll be waiting to take your call and to hear from you. So I'll see you shortly. Welcome back. So we take testimonial videos from some of our manufacturers and also some messages from some of our numerous customers. Remember, we have a lot of product in stock that you can benefit from with this 10% discount offer that we are giving. Remember to contact us using any of our email address or contact phone numbers that will be displayed at the end of the show. I will see you shortly after these last videos.
Hello everyone and greetings to Nigeria. I hope you, your colleagues, and your families, you're all doing well. My name is Ioannis. I'm the area manager at Sika, and I'm responsible for the African region. Sika, a German-based company based in the northern part of Germany, in Hamburg. We're doing medical skills and measuring solutions, means from the baby scale up to adult skills for a special kind of patient, like obese patient or patients who are lying in bed, nutrition, for nutrition departments, ICU, so all the different kind of skills, we provide the right solution. We're doing this since 180 years, so a long history for this company. We are operating in more than 110 countries worldwide, and of course we're doing this in some countries directly, but in the majority of the countries we do with our local partners. In that case, I'm really happy that for Nigeria we are working with Mogbonju, and we are happy to have such a reliable partner. But what means partner for us, for Sika? A partner is someone who shares the same values and strategy like Sika. So it means we believe in high quality products. We believe in to provide the right product to the right client and to fulfill the customer needs. A partner means also that has a good product knowledge and is always capable to provide the right solution to the customers. Furthermore, just to sell the product is not enough for Sika, so we also believe in a very strong after-sales support and in general maintenance and service for our products, so that we ensure that the customer's investment will be long-lasting over the years. A very important part also for Sika, and once again we are really happy. I'm really happy to work together with Mogbonju. Best greetings, Madame Ayo, Stephen, and the entire team of Mogbonju. I wish you all the best. Hope you're all doing well, and a lot of success with this virtual exhibition. I think this is a very difficult year, and of course we have to adjust the way we do business. And I'm really happy that you're trying to do this virtual exhibition. And once again, thank you very much for all your effort, for all your support over the years. And I wish you all the best. Take care and a lot of success. Greetings from Germany.
Hello everyone, my name is Purvesh Shah from VS International. I'm the director of the company, and we are partnered with Mogbonju for our range of healthcare products which are branded Mediwise. And I would like to say a few things about the erstwhile founders, owners, and very stalwart ladies, they would be called, Chief Mrs. Betty Ojo and Chief Mrs. Ayo, who are both closely associated with us in working and in promoting and in harboring relationship between the two companies. And I would like to say a few things for this conference that we are having virtually this time because of COVID. First of all, the two companies are well aligned, and our thought process is the same because Mogbonju and VS International both believe in quality, which is the paramount thing in all our products. Whatever we do, we don't compromise on the most important fundamental, which is quality. Secondly, we also believe in deliverables as promised. When we tell a customer that our quality and our deliverables are so and so, we stand by it. We believe in it, and we know that it is very important for us to deliver on those commitments. And also, we both the companies also believe in no compromise on after sales or on the service aspect of the products that we deal in. We know for a fact that these are healthcare products, these are products which are for life saving and for hospital use, and so it is paramount for us that customer focus and customer centric is what our companies are. We believe, and we all know, and we also proclaim that for us, customer first, that is our most important criteria. Also the fact that everything that we make and everything that we achieve is because of our partners, and we find that in Mogbonju. They are our preferred partners. They are someone who we know for sure will deliver on the promises, will promote our products the way we would promote them, and we have a relationship which is kind of aligned in all aspects. So once again, I wish them all the best for this virtual exhibition, and we always come, we always participate. Unfortunately, we won't be there this year, but our our support, our feelings, and everything is with them. All the best, Team Mogbonju.
Good afternoon. My name is Ms. Odubela from Surgical Emergency. This exhibition has been an eye-opener to the various kind of equipment that are available and the ones we are lacking, and we are grateful that they're giving us a discounted price so that we'll be able to purchase some of them. We are very, very interested in most of the equipment here, and we hope to get them very soon.
My name is Mrs. Priska Kepe from Surgical Emergency Lawsuit. I'm so pleased and so happy coming to this seminar. Some of the equipment presented, I've not seen some before, but at least it's an eye-opener, and I believe our CMD will be able to provide some of them, which start using them, like the fission pump, which to help us a lot. So the equipment, they are wonderful. Thank you, and thank you so much.
Mrs. Dorothy Young, Director of Nursing Services, Federal Medical Center, Butemeta, Lagos. What I see and feel about this exhibition by Mogbonju Nigerian Limited is a very good one. And I'm impressed because a lot of instruments and equipment are so good. Like I saw the ECRA sphygmomanometer, and I've told them I want the acousin of it. I've seen a lot of beds, the 3-crown beds, the 5-crown beds, which in my hospital we may need them. So I want to go and discuss with my medical director, the Dr. A.A. Dada, about it. I've written and gotten some lists that I'll go and discuss with him. And I saw uniforms here. In our hospital we have a lot of uniforms. The accident and emergency is wine. And then the pediatric is flower. They said they can produce if I need. So I'm so much impressed. I know all the things that we need are here. And I've taken the exhibition office in Ogudu, which I will make a visit there. So I'm so impressed. And I want to thank the managing director, Mrs. Ojo, for what she has done. It's doing service to humanity.
There you have it. That is our show. Mogbonju Nigeria Limited Medical Exhibition, the virtual edition in 2020. We're glad you could join us, and we hope you enjoy all the session from day 1 to day 3 as much as we do. Remember that the 10% discount is still ongoing. So we encourage that you call us, contact us via email. We'll be waiting to take your order and also to be able to apply this special discount for you. Email address and contact address and phone numbers are displayed on the screen right now. Remember, we have a lot of products in stock, just as you have seen. Some we could not show. We have numerous products from PPE and sanitizers, pedal dispensers, face masks, N95 face masks, disposable face masks, and gloves. We have hospital beds, bedside lockers, over bed tables. We have ventilators in stock. We have video laryngoscope. We have theater light, baby incubators, laboratory incubators, autoclaves, and so much more. So we'll be waiting for your call, waiting for your contact. We will definitely will be glad to receive your order. So that's our show. We are glad you could join us. Remember, Mogbonju Nigeria Limited, distributor of high-quality medical products in Nigeria. We are so happy, and we pray that the Almighty will continue to protect us all. During this pandemic, we will definitely be able to overcome it, and then we hope to see you and more of you even after now. Thank you. That is our show. The promo still runs till end of October 2020. So if you have any inquiries, any questions, any products whatsoever, please feel free to contact us via our contacts that are displayed on the screen right now. So we are glad you could join us this far to the end of the program. Thank you once again. God bless you and have a nice day.